But you did mention one side effect of one specific medication, which was the bowel upsets or digestion problems. So for people who think, well, I've got a medication for everything, all of my conditions, what's wrong with that? Because I've had that question asked to me. I do health coaching, and so why can't I just take the pill? What's wrong with it? I mean, I'll just take it. It's lowering my hypertension, and I'll just eat the carbs that I love to eat. What you say, of course, it is people's choice, and none of this intervention, lifestyle intervention, can be forced upon people. However, let's talk more and make people aware, because I don't think they are made aware of long-term side effects of some of these medications.
Yeah, I think it's a really good point, and good to highlight that it's very much what the patient wants to achieve. I think an important thing, certainly from my point of view as a doctor, is making sure that they're doing what's called informed decision making. So they truly understand that decision they're making, and really taking medication to deal with a problem that's secondary to lifestyle, they shouldn't really view as on a par with fixing the root cause. Maybe a simple analogy would be if you're driving along a road that's 30 miles an hour and you're putting your foot on the accelerator so the car's doing 50, but you decide you're not going to take your foot off the accelerator, you're just going to jam your foot on the brake at the same time and try and judge that at the right level to keep the car at 30. That's a completely different scenario to just letting your foot off the accelerator and letting the car happily tick along at 30 miles an hour. So most of these drugs that are trying to fix effectively the result of poor metabolic health and lifestyle drivers for that they're not actually having as much benefit as people come to believe. They're a sticking plaster at best often. So I think they need to be clear on that. But many patients, I'd say some patients, even when they know that it's the right option for them, which is fine. But I would say many haven't been. They're not really. I think we do a very poor job of helping people understand even the basics of how the body works. So all they see is that blood pressure number and where it is, not why is that blood pressure where it is and what are the other problems going on in the body because of that.
Mm-hmm. I mean, I found out recently that some of the blood pressure medications, for example, or at least one group of them, raises in blood glucose levels. And I'm thinking, yes. Okay, well then, I mean, that should be something that patients are made aware of.
Yeah. The thiazide diuretic blood pressure tablets, they increase your risk of type 2 diabetes, which
doesn't really help the situation, because the more insulin resistant you are, the likelihood that your blood pressure is going to be stuck higher up.
Yep, and your glucose will be higher anyway. And and there's other blood pressure. There's a blood pressure tablet called amlodipine, which many people will take, and it 50% of the time causes ankle swelling. And so we're kind of fighting the ankle swelling, and people are putting up with a bit of ankle swelling, but actually, again, blood pressure can improve quite significantly. Some people, but not everyone, so I wouldn't want to overpromise, but for some people that say, well, let's address the metabolic health, let your blood pressure improve, so I'll get you off the drug and everything's good. And another drug with diabetes, metformin, fascinating. So many people take metformin for type 2 diabetes, but I've found over the years, and I've worked in a few different practices, so I sometimes pick up patients that may not have had a in-depth lifestyle chat and been on metformin for years, not realizing that it's the metformin that's been upsetting their gut. So metformin for at least a quarter of people, at least, probably more, causes diarrhea, changes your taste, bloating. And many of them just hadn't been pieced together that this was the cause. They'd been off a colonoscopy, so cameras up the bottom. They're on drugs to try and constipate them. I've had patients that almost can't leave the house, like widowed and kind of lonely, but can't leave the house because their bowels are so upset. You stop the metformin within 3 days. The bowels are better, which is, I'm kind of laughing at it, that it's so ridiculous, but it's such a simple, sad situation. But
thank you for mentioning that. I didn't know that about metformin, but I was fascinated recently when I heard that some type 1 diabetics now are requesting their GPs to prescribe metformin for them to help them with insulin sensitivity.